Good afternoon, everyone. So we would like to start this session early so that we can all have a good break after that, right? So I'm Wei Yan, and I have my co-chair here, Dr. Sumita. So without further ado, we would like to begin this session. Can I invite the first speaker, Dr. Shi Ming Su, to speak on the profiles and clinical significance of extraocular muscle expressed INC increased RNA and mRNA in oculomotor nerve palsy. Dr. Shi Ming Su. Okay. Shall we have the second speaker, Dr. Chongtam Devi? Okay. She'll speak on the strabismus profile in the tertiary eye care center in Manipur. Dr. Devi, please.
Okay. Good afternoon, respected chairpersons and everyone present. My topic is strabismus profile in a tertiary eye care center in Manipur. There is no conflict of interest. Aims and objectives were to study the trends of different types of strabismus presenting to the hospital, material and methods, retrospective data of all the patients presenting to the OPD of the hospital from March 2015 to March 2020 was collected, and strabismus patients in all age group were included in the study. A detailed history, visual acuity, refractive error, type of strabismus, stereo acuity, anti and posterior segment status, etc. was noted. Patients were broadly divided into children less than 16 years of age and adults more than 16 years of age. Adults were further subdivided into 16 to 40, 40 to 60, and more than 60 years of age. It was a retrospective observational type of study. The total number of strabismus patients included in the study was 1,890, out of which 52% were females and 48% were males. Number of children was 40% and 60% were adults. The age range from 2 to 82 years at presentation with a median of 27 years. And from this pie chart, we can see the maximum presentation was from 16 to 40 years, followed by children. Sex distribution, there is a slight female preponderance in all the age group except in 41 to 60 years of age. Significant past history in children of premature birth was present in 3%, previous cataract surgery in 1%, ocular trauma in 2.6%, family history of strabismus in 3%, and some other syndromes. In adults, ocular trauma history was found in 2.8%, and family history of strabismus was found in 1.3%. Type of strabismus, this chart shows that exotropia is the most common type of strabismus prevalent in all the age group. So in children, we found that 58% had exo, 40% ESO, and 2% had vertical strabismus with a significant p-value of 0.001. Adults, 81% exo, 17% ESO, and 1% vertical strabismus. Again, a significant p-value of 0.005. Hence, proving that exotropia was the most common type of strabismus prevalent in all age group in the population. The children less than 16 years, in exo, intermittent exotropia was the most common. Essential infantile esotropia was the most common presentation in the esotropia group, and esopelsi in the vertical strabismus group. In adults, intermittent exotropia was the most common, and esotropia, non-accommodative esotropia was the most common, and esopelsi contributed to maximum of the vertical strabismus. These are some specific type of strabismus found in both children and adults. Associated refractive error. Children with esotropia, hypermetropia was associated in 30% of the cases. 11% had myopia, and the rest 59% were emetropic. Out of the 30% associated with hypermetropia, 7% had hypermetropia more than +4. In children with XT, myopia was found in 25% of the cases, 5% associated with hyperopia, and 70% were emetropic. Adults, myopia was found to be associated in 60% of the cases with ET and with XT, and 7% of the cases with ET. Amblyopia was found to be associated in 30% of the cases and 14% of the adults. The angle of strabismus, it was found that the maximum number of presentation in both the age group were those of 40 to 60 PD of deviation, that is moderate to large angle of deviation. Steropsis was present in a total of 34% of the whole patients, out of which 89% were those of intermittent XT, 16% with ET, and 25% with SO-palsy. Rest, 66% of the patients, there was absent steropsis. Out of the total children, 50% of the children were advised for surgery, and out of this 50%, only 40% underwent surgery. In adults, 42% were advised strabismus surgery, and 40% of these, those who were advised surgery, underwent surgery. So, to conclude, exotropia was found to be the most common type of strabismus in patients attending the center in all the age group. Slight female preponderance was found in the region. The moderate to large angle of strabismus were the most common type of presentation. Maximum presentation is in between the 16 to 40 years age group, and only 40% of those advised for surgery had undergone it. Thank you.
Did you assess how many exotropia, how many were sensory, or was there
No, ma'am.
subgroup analysis?
No. We just included the exotropia and esotropia and vertical strabismus. Vertical strabismus group included only those presented with vertical. Then those who presented with horizontal and vertical were grouped with the horizontal strabismus. So that was not taken into account.
Thank you.
Thank
How
you.
about those patients with, like for example, infantile ET with dissociated vertical deviation? How was it grouped? And for
It was grouped with esotropia only, but if surgery was done, it was inclusive of the vertical also. And I'd like to mention one thing, ma'am. The studies recently conducted in North India and LVPI and all by Dr. Ramesh. 2024, there's one study by Dr. Ramesh which said that in children, esotropia was more common. And again, in North India, from Aligarh Muslim University, one study says that esotropia is more common in children. But in our study, we found that exotropia was more common in children also. So that is in adherence to those studies which was carried out in the Chinese and the Japanese population. Yes, ma'am. Yes, ma'am. Yes, ma'am. Thank you, ma'am. Thank you.
Dr. Mohammad Al-Fati to present on his history paper on COVID-19 and acute acquired comitant esotropia, a meta-analysis of retrospective studies. Is Dr. Al-Fati here?
Hello everyone, let me introduce myself. My name is Muhammad Al-Fatih. I'm from Faculty of Medicine, Universitas Indonesia. I'm a fifth year medical student. I'm deeply sorry that I cannot attend the meeting in person due to a flight ticket issue that I encountered in the last few days before the meeting. So this is my presentation about COVID-19 and acute acquired concomitant esotropia. I conducted this study as a meta-analysis of retrospective studies published in the literature with some of my colleagues. So, as the purpose itself is to review the association between COVID-19 pandemic and characteristics of acute acquired concomitant esotropia patients. Methods, all aspects of the systematic review and meta-analysis adhered to the Cochrane Handbook, and all the eligibility criteria include studies that directly compare the data of AACE between patients in pre-COVID-19 and COVID-19 pandemic era. So three databases, PubMed, Scopus, and Central, were systematically searched using keyword COVID-19 and AACE. We use synonyms, Boolean operators, and wildcards, where variation might occur due to the database scripts. Two independent authors performed the screening of the title and abstract and study quality assessment, also the data collection. If there's any conflicting decisions, the third authors would decide, and we conducted the meta-analysis using random effect model with Rahman 5.4. So two studies were ultimately included. One study was conducted in China and the other was in Italy. Both studies showed that since COVID-19 pandemic, the number of AACE cases is increasing. The result is no significant difference in the meta-analysis when we compare the age, gender, maximum far deviations, maximum near deviation, left equivalent spherical degree, and the right equivalent spherical degree between the AACE patients in pre-pandemic and post-pandemic era. So the only significant result is the low odds of pre-pandemic patients to have type 3 or Biles-Chomsky type compared to the post-pandemic patients. So COVID-19 has a substantial impact on the incidence of AACE, but their characteristics are not so much different compared to the pre-pandemic era, except for their odds to be a Biles-Chomsky type. Biles-Chomsky type is traditionally associated with myopia and excessive near work, and during the pandemic, lockdown measures led to increased reliance on digital devices for work, education, and social interaction. This results in prolonged near vision activities, and studies have shown that cases of AACE precipitated by excessive near work during home confinement. This supports the hypothesis that increased near vision demands during lockdowns may have influenced the subtype distribution of AACE. And this is the references that I used to make the study. Thank you. If you have any if you have
Thanks, Fatih, for the presentation. So I'd like just to ask, in terms of your search criteria, because there's only two studies, you said you wrote there the search criteria was stemming from COVID-19.
I don't
So
think he's online.
it's not online.
Online नहीं है ना? Only video play. You can make your comment.
Okay. Okay. So actually, the question I was trying to ask is that because of the way the number of studies is a bit low, so whether he used the search term COVID-19 only, or did he include things like coronavirus, etc., that can actually span the search terms for the scopers as well as PubMed, etc., and that might bring out more papers, and that we also will need to see how many papers were actually included, whether all of them were English, or all of them were many of them were abstract only. That's why they were excluded, etc. So sometimes in meta-analysis, these are some of the important details that we'll need to be able to interpret the results.
Because I am at least knowing at least 5 studies, 5 or 6 studies which have been there since 1922.
Moving on, can I check, is Dr. Wu Lianqun here? Dr. Wu Lianqun? Or Dr. Shi Mingsu?
So we are going to invite Dr. Suptida Jiam Sawad for. Am I pronouncing it correctly?
That's right.
Okay. Thank you. To present her paper on clinical characteristics, diagnosis, and treatments of pediatric nystagmus.
So good evening, everyone. My name is Suhaira Jamswat. I'm the representative from Sirirat Hospital from Thailand. So, Swadika, my name is Da. Please call me, that's my nickname. And this is a research about the clinical characteristic diagnosis treatment of pediatric nystagmus. And it was supervised by our professor, Ajahn Pitaya Pamon Wechawan and Ravi Jongpipat Chai. And for this, I have no conflict of interest. For the objectives, this research is to report the clinical characteristic types, cause, and management of the pediatric nystagmus diagnosed within 15 years past in Thailand. Because we have so limited information about this, that's why we had to conduct this. And all the patients that was diagnosed as the pediatric nystagmus before the age of 18 was included. With that, it's not working. May I have the next slide? Oh, okay, sure. So with this, 328 patients was included, with 21 of the patients were excluded due to unsure the onset of the nystagmus, whether it was the pediatric nystagmus or not. And with this, the patients was divided into the retinal optic nerve abnormality, anterior segment abnormality, no definite diagnosis, neurological abnormality, late latent nystagmus, and idiopathic INS. With this, we found that the most common type, the three most common type was the retinal or optic nerve abnormality, followed by the idiopathic INS and the anterior segment abnormality. From this, the nystagmus itself, from this it is the table about the VA and the characteristic of each cause of the nystagmus. The nystagmus associated with the CNS tumor exhibited the best VA. About half of all patients diagnosed as CNS tumor had an optimal visual acuity defined as better than 20/40. And the majority of the low vision defined as the VA lower than 20/200 were nystagmus associated with anterior segment abnormality and retinal or optic nerve abnormality. For this, it is a treatment, the distribution and the choice that was given to the patients according to each cause of the nystagmus. Regarding the treatments in general, the nystagmus patient that required, the treatment that patient required the most was the refractive correction, followed by the surgical correction, and followed by list for medication. And for the discussion, it is known that the vertical nystagmus typically the sign of CNS cause, but among the patients with vertical nystagmus, nearly half actually have the optic nerve abnormality, which so this highlight that we should consider the non-CNS cause in evaluation as well. And with this research, we also explore the outcome of the ERG that was applied to the patients. And ERG was found to be the crucial diagnosis tool, particularly in a case where diagnosis was uncertain, which support the use of ERG to prevent these diagnoses such cases as idiopathic INS. And with this, the idiopathic infantile nystagmus syndrome in our study showed a VA better than a finger counting. Therefore, further investigation should be considered in the patients who are questionable of the idiopathic infantile nystagmus syndrome with the poor initial VA presentation. Well, there's some limitation since it's a retrospective study and we have some missing data and some underrepresentative of the late nystagmus due to the ICD code and how we find the HN code. And however, we are conducting this as a second part right now. And for the conclusion, nystagmus in pediatric patients is highly diverse in etiology and presentation. So ERG is highly recommended in ambiguous cases. Refractive correction play a low foundation role in the treatment, while the surgery is often reserved for structural or CNS-related cause. These findings might help guide and for the better diagnosis and management for the pediatric nystagmus in the future. So thank you very much. ขอบคุณค่ะ
Hi, sorry, can I check? I was looking at the surgery. So, especially for those that are not the non-INS type, what is it? Is the surgery ocular surgery or cranial surgery, or what surgery was it referring to?
Well, actually, it's a bit unfortunate. I mean, unfortunately, our research does not have the detail what the surgery it was done, which was another limitation. But in the future, I will explore that more. I mean, it just have only surgical and the non-surgical, but the detail was not noted down.
So do you know whether it's surgery to the eye, at least the extraocular muscle, or?
Oh. It was noted down. I'm so sorry. Yes.
Access to the actual records.
This was a research that was conducted some times ago, so the information was quite missing about the detail about surgical procedure. But
why we are asking is this because nystagmus is very often associated with strabismus, so or surgeries are a lot of time done to correct the head postures or even for dampening the nystagmus. So we just wanted to know the details, what kind of surgery was done. So
yeah, I would take that.
If you don't have data, then
I will take that for the second part.
yes.
Okay, thank you. Thank you very much.
Next, can we have Dr. Yu Ying-Qing? Okay. Then moving on, can we have Dr. Aida Kapanova? Yeah. She'll be presenting on the bacteriological profile and antimicrobial resistance in children under 2 years of age with congenital nasal lacrimal duct obstruction.
Okay. Good evening, dear colleagues. It's a great honor to be a part of this Congress. There are no conflicts of interest to disclose. Congenital nasal lacrimal duct obstruction is a common cause of epiphora and purulent discharge in children under 2 years old with a prevalence of 11 to 20%. The role of antibiotic therapy remains debate as excessive use can contribute to bacterial resistance, a global concern. Without timely treatment, it may become chronic, leading to recurrent infection and inflammation of ocular adnexa. The objective of this study is to determine the antibiotic susceptibility of microorganisms and develop a resistance profile to guide the selection of the most effective treatment strategies for improving outcomes in young children with nasolacrimal duct obstruction. The study is a retrospective, single-center descriptive study conducted at the Kazakh Eye Research Institute from January 2017 to December 2022. It includes children under 2 years old with congenital nasolacrimal duct obstruction and a positive microbial culture, while excluding those with a history of prior intervention or prior use of topical antibiotics. Conjunctival cultures were collected using an improved methodology. Samples were cultured on standard media. Antibiotic susceptibility testing was performed using the YTEC2 compact automated system. Statistical analysis was conducted with GraphPad Prisms 8. Moving on to our results, this chart illustrates pathogen distribution in children under 2 years. A total of 210 eyes were examined. Testing was highest in 2018, 35%, and 2019, 31%. Dropped in 2020, 2.1 due to COVID-19, and gradually increased in 1991 and 1992. This slide shows that gram-positive bacteria dominated 77%, while gram-negative accounted for 22%, and fungi for less than 1%. Facultative anaerobes made up 75%, with aerobes at 25%. Staphylococcus epidermidis was the most common gram-positive bacteria, gram-positive isolate, followed by Staphylococcus aureus and Staphylococcus saprophyticus. Among gram-negative bacteria, Escherichia coli dominated, with Pseudomonas aeruginosa and Enterobacter clock ranking next. The comparison of bacterial profiles in children under 2 years old revealed significant differences between infants under 1 year and those older than 1 year. Fisher test confirmed a statistically significant variation in bacteria species depending on age. This suggests that the conjunctival microbiota evolves as a child grows. Moxifloxacin shows the highest efficacy, followed by levofloxacin and gentamicin. And gentamicin and vancomycin were also effective, but less so. Resistance was highest for erythromycin, gentamicin, tetracycline, and chloramphenicol, likely due to prolonged clinical use. A review of international studies shows that our study mainly identified opportunistic pathogens, whereas global data reports more virulent species, likely due to sample size differences. Antibiotic resistance trends align with the global patterns. In conclusion, in children under 2 years old with congenital nasal lacrimal duct obstruction, the most common bacteria include gram-positive Staphylococcus and gram-negative enteric flora. A significant proportion of isolates were facultative anaerobes. The obtained data of the compositive of conjunctival microflora combined with antibiotic sensitivity and resistant analysis provide the foundation for rational approaches to antibiotic therapy in young children. Thank you for your attention.
May I now request Dr. Alicia? Thank you.
Thank you.
Dr. Alicia Lu, she's here.
Is Dr. Ding Xiaoyan here as well? Then can we invite the next speaker, Dr. Sati Gargulian? She'll be speaking on the effectiveness of using liquid crystal glasses in the amblyopia treatment in children. Dr. Sati.
I'm Dr. Victoria. Sati unfortunately not able to be attend. That's why I will represent this. Good day, dear colleagues, and thanks again for the organization, for the invitation. And let me introduce our presentation about amblyopia treatment. So I have financial interest. Our group of authors are patent holders. And as you know, treatment for amblyopia involves methods that reduce the visual input to the non-amblyopic eye. At present, the standard treatments for unilateral amblyopia include occlusion through the use of an eye patch or atropine penalization of the dominant eye, and vision therapy is frequently employed in our clinic. All of these treatments successfully improve, sorry, you forgot your phone. Or somebody maybe. So at present, the standard treatment for unilateral amblyopia include occlusion through the use of an eye patch or atropine penalization of the dominant eye, and vision therapy is frequently employed in our clinic. And all of these treatments successfully improve visual acuity in children, provided that patients follow prescribed treatment plans. And adherence to treatment is critically important for patients with amblyopia. According to results of different research groups, compliance fluctuates between 41% to 70%. And for this purpose, Professor Igaraz Nauran developed a treatment method for amblyopia at the Yasmin Zor Pediatric Eye Clinic using Straba glasses. And this approach involves periodic alternating oscillation where the better seeing eye is intermittently uncovered, creating a dioptic state that enhances visual acuity. We did prospective randomized research. The first group of children had undergone treatment with computer program POISC vision therapy for amblyopia treatment, which provides the separation of the fields of vision of the right and left eye using Polaroid glasses. In this case, the better seeing eye was presented with an imaging 50% less than the worse seeing eye. And the second group of patients, 45 children, were prescribed treatment by Straba glasses. So here is the clinical characteristics of the groups. Most of the kids have amblyopia, 20 by 40 and 20 by 30. Groups difference were statistically insignificant. So in this video, I want to show you a program that allows us to program these glasses for any value of alternation frequency. In this study, we empirically chose a frequency of 50 milliseconds. And in the group of children treated with Straba glasses, after the course of treatment, a more pronounced increase in visual acuity was revealed than in the first group. And in the intergroup comparison of the increase in visual acuity, significantly higher rates were observed in the second group of children with Straba glasses compared to children with Polaroid glasses. So when comparing the binocular vision before and after treatment in patients who undergone treatment with Polaroid glasses, we saw an increase in the number of children with stable binocular vision from 28% to 46%. In the group of patients with Straba glasses, the number of children with binocular vision increased from 30% to 80%, which exceeded the indicators of the group of children with Polaroid glasses. And the number of children with stereo vision increased significantly in the both group. So in the group of children with Polaroid glasses, this number increased to 48%. In the group of children with Straba glasses to 80%, and was more significant than in the children with Polaroid glasses. As a result of functional treatment of amblyopia, both groups of children shown an increase in visual acuity. Not all slides. Visual acuity showed an increase in visual acuity, an increase in the number of children with binocular vision and the presence of stereo vision. More significant improvement in visual function was observed in the group of children with Straba glasses. And the results obtained may indicate a higher efficiency of using the principle of phase haploscopy compared to visual occlusion in the treatment of amblyopia in children. Dear colleagues, thank you for your attention. That's it. Mostly there were the refractive amblyopia, but we also treat using these Straba glasses, this binocular amblyopia, but after the previous surgery on oculomotors. No.
Sorry, can I check for this, the amblyopias, were they refractory to optical correction itself, or it was treated together?
Together.
But then that will become a confounder, right?
You're right, yes. Okay.
So when they are on the Strabo glass, are they asked to do a certain activity? Or?
Sorry?
when they are on the training with the
Yes,
Strabismus?
training they wear, and they can learn, they can do their homework, they can play their favorite video games, they can do everything. Yes, thank you.
Thank you.
Thank you.
I think we have the last two. So can I check if Dr. Xu Duo is here? Okay. Then we'll have our last presenter, Dr. Vera Yarovaya. She'll be presenting on gamma knife radial surgery of diffuse choroidal hemangioma in Sturge-Weber syndrome.
Hello, dear friends. We are going to present our experience of gamma knife radial surgery of diffuse choroidal hemangioma in Sturge-Weber syndrome. So I have no financial interest or relationship to disclosure. And it is known that diffuse choroidal hemangioma can be treated with proton beam radiation, either with the gamma knife radial surgery, but the data is very limited. So we'd like to present two cases. The first case was about the girl of 4.5 years old with bilateral diffuse choroidal hemangioma with Sturge-Weber syndrome. It is known that usually this syndrome is presented with nevus, with Fleming nevus, with bilateral diffuse choroidal hemangioma, and with leptomeningeal hemangioma. So the right eye was presented with a hemangioma of 5.3 millimeter in thickness, and the left eye was presented with diffuse choroidal hemangioma of 6 and 0.8 millimeters in thickness with total retinal detachment. So the left eye was treated with brachytherapy, and within 12 months, partial tumor regression was seen, but also we've seen V-shaped retinal detachment with complete vision loss. The right eye was stable for some time, but within 8 months after the first visit, the thickness of the choroid became thicker. It was measured 6.4 millimeters, and retinal detachment occurred. So there was an attempt to use immunotherapy using sirolimus, and as you can see on the slide, within 14 months after our observation, retinal detachment a little bit completed, but after that, retinal detachment was observed, and it was very high, 6 millimeters in thickness. So there was a question, what should we do? Brachytherapy was rejected in this case because there was a high risk of vision loss in the only seeing eye. So we've obtained an attempt to perform gamma knife radial surgery for this case, and it was performed under the general anesthesia using the eye mobilization, fixing 4 rectus muscles with the sutures and with frame fixation. As you can see on the slide, we've used, during the planning, we've used 2 PTVs, two focuses to irradiate, excluding the macular and the central region, and the prescribed dose was 18 gray. So 1 month after the gamma knife radial surgery, thickness of the choroid decreased, and but the retinal detachment increased. But within follow-up period of 5 months and 9 months, retinal detachment has completely gone, and the thickness of the choroid measured 2.8 millimeters. So the eye fundus examination demonstrated 2 tracks after the irradiation, excluding the central region of the eye, and the treatment aims were achieved, including the saved eye. It was the single eye, we should remember. There was no retinal detachment, there was macula intact, and also high vision in the single seeing eye. So, and the second case we'd like to present was about the boy of 15 years old. He also had diffuse choroidal hemangioma. there was secondary retinal detachment. He was previously treated with a coagulation elsewhere, and papillomacular bundle was damaged during the laser. So choroid hemangioma was very thick, 7.3 millimeters, and the retinal detachment was total. We've also irradiated on the upper side of the eye, excluding the center. And during the follow-up period of 6 months, retinal detachment has completely gone, and the high of the tumor was 4.4. And as you can see, the MAC is intact with a vision of 10%, but it could be better if there was no laser coagulation. So in conclusion, we'd like to say that diffuse choroidal hemangioma with a secondary retinal detachment has very limited number of suitable treatment options, and gamma knife radiosurgery is a promising approach which allows to achieve tumor thinning, to resolve retinal detachment, and to improve vision. Thank you.
Thank you for the thank you for the nice presentation.
Thank
Is
you.
there any comments from the floor? It's a rather specialized treatment for choroidal hemangioma. So, Sumita, any comments? I mean, from my side, it looks like a very interesting treatment. That is especially might be beneficial, though sometimes not every region might have availability of gamma knife. I think in Singapore, only our National Cancer Center might have availability of the gamma knife. So for this child, for the younger child, you have to put him to sleep and then anchor all 4 recti muscles, right?
Mm-hmm.
How about the older child?
Usually we do retrobulbar anesthesia for elder children, and also fix 4 rectus muscles, but under the retrobulbar injection.
Okay.
So the second one had a kind of scarring right through the papillomacular bundle. Did he improve vision?
He improved vision because of the retinal detachment that was gone, but there was a scar, and
exactly.
it was damaged, unfortunately.
So did not have very good recovery.
The maximum that we could achieve was 10%.
It's actually very rare to see retinal detachment with choroidal hemangiomas, or is it very common?
Do you ask about how is it common? We have 15 patients that were treated in this way. And in most times, usually, these hemangiomas are stable. But sometimes, nobody knows what occurs, but sometimes they progress. Thank you.
Thank you.
Thank you, everyone. We have come to the end of the rapid fire session. So it's a pity that some of them couldn't.
We really finished rapidly.
So I'd like to wish everyone a good evening as well as a good stay in New Delhi. Thank you.
All the presenters.